Hi, this is Dr. Neal Schwartz. Today I'd like to continue my video series on all acne treatments with a comprehensive review of estheticians and spa treatments for acne. Now, before I get into any of this, I want everyone to know that my intent is to prevent future emotional trauma and create realistic expectations for acne sufferers entering these treatment programs. Let's start with the pros of seeing an esthetician at a medi-spa, a spa, or even an esthetician in a dermatologist's office. Number one, powerful remedy options. When an acne patient goes to see an esthetician for a facial, an extraction, a peel, microdermabrasion, whatever it is, they are going to get about 10 times the work done on their face than they could have done on their own at home. Estheticians sometimes have 10, 20, or even 30 years of hand skill experience to really work the skin in ways that an amateur or someone who's only had acne for a few years could never accomplish. So that's pro number one, skilled remedy options to bring down inflammation quickly in the short term. Number two, estheticians can spend more time with clients by sitting and extracting or peeling or microdermabrating, whatever they're doing to them. They have a full half hour to chit-chat with their clients and develop a real practitioner relationship, one that is based in trust and one that is based in a back and forth that will oftentimes create the threshold of clinical success. Number three, estheticians universally care. You'll be hard-pressed to find an esthetician who doesn't care deeply and emotionally about their acne clients. They are very passionate and they are very goal-oriented in getting people better. Sometimes in medicine, this level of care and passion is actually the make or break moment whether someone gets better. Other times, this energy and passion is not the make or break, and we'll speak about that as well. So those are the major pros I see to an acne patient seeing an esthetician for their acne treatment. Now, let's talk about the cons, in my experienced opinion, of estheticians in the treatment of acne. If you are an esthetician, please do not be personally offended by these cons, as I have witnessed these cons all over the country, and they may not be speaking about you personally, but they certainly are speaking of the system, and I think with some investigation and reflection, you'll be able to see some of these cons as well. Number one, inadequate success rates for long-term satisfaction. I have met countless acne patients who have spent thousands of dollars with their esthetician, and they know and their esthetician knows that all the work being done brings temporary gains and does not bring any form of inactivation in the future. Not to say that some people who go to estheticians do not find long-term satisfaction. What I'm saying is the success rate is not adequate. I'm meeting the clients after they fail these protocols and after they spend thousands of dollars. Their faces are not better. Their faces are not inactive at all. And the preventative strategies are oftentimes what I would call ineffective. So, let's be real. When an esthetician lays down a protocol of 5 to 7 treatments weekly for your skin, everyone needs to have the proper expectation for this protocol. What you're paying for is to catch up with the acne, get rid of the old bumps, get rid of the old marks, clear the face, and look better for the time being. But everyone needs to know that if they're not preventing future acne during that treatment protocol and immediately after, that they are going to relapse and feel that they have wasted money. In order to not feel like you've wasted money with your esthetician, have the proper expectation. You're going there to get cleaned up, to get free of many old bumps, to get free of many old marks, to clear some of that thickened skin, to get your skin healthy, much like a workout would do if your body's unhealthy. You're going for a personal training session. But everyone should know, if the prevention is not proper, whether you're using the prevention from your dermatologist or using the prevention from your esthetician, whatever it is, if the prevention is not adequate, these treatments will be in vain if you're looking for long-term satisfaction. Number 2, I dislike the language being taught by esthetician schools. I don't like the acid mantle philosophy. I don't like the pH balance philosophy. I think it creates more confusion among patients who then use this science to try to make sense of their failing acne treatment. Although in prior videos I mentioned that Western medicine has some pitfalls in regards to acne treatment, when it comes to the science of anatomy and physiology, I prefer the Western medical terminology. Number 3, sometimes estheticians get in over their head. I've seen it in my own estheticians' faces in my office when I bring them a severe case of acne. The shock and the surprise that they are seeing oftentimes is overwhelming, and it's difficult for a non-physician to handle extreme cases of acne. I've seen this firsthand. I've had many estheticians work for me, and I've seen that some cases are big enough to push outside the comfort zone of an esthetician practice. Number 4, the communication. If you are an esthetician and you want to become a master esthetician, know that your communication with your clients is key. When you meet them on day 1, give them the proper expectation and tell them when to pull out of treatment with you. If you can create that type of goal-oriented approach, and an approach that doesn't just cater to your own practice, that will be a masterful esthetician practice. So that if they are not improving in the first few weeks, they know to go see a physician. That type of out will make you a credible esthetician. Unfortunately, what I've witnessed is that estheticians sometimes, to keep their practice alive, will hang on to failing clients using a hope and wait strategy to try to eventually overcome a situation that is not getting better. My recommendation is to communicate with your clients to allow them to pull out at any moment that you both agree that they are not getting better. That would be a masterful esthetician practice. Know what you know exactly what you don't know, and know exactly when a client is improving or when they're not improving. If you can do that, you'll prevent any of the emotional trauma that I've seen from these practices. So here's the bottom line for treating acne with estheticians. This is still a recommended practice if your preventative strategy is working. If you are on a trajectory towards getting better and every week you're seeing improvement, then these treatments can speed up the resolution of old bumps and old marks and thickened skin and everything I mentioned prior. However, be conscious that these practices don't always create that trajectory, and if not improving within the first few weeks, you need to discuss it with your esthetician first and then consider other options if you really aren't improving. Of course, knowing whether you're getting better or worse is an art in itself, and you can ask your esthetician, am I getting better or am I getting worse? Tell it to me straight. If your esthetician can tell it to you straight, even when you're not doing better, that would be a more masterful esthetician practice. I hope this video helps to prevent future emotional trauma for all acne patients. I'll talk to you soon. Take care.